everyone. I'm Jim Longworth, and welcome to another edition of Forsyth County Connections, coming to you from the Government Center in downtown Winston-Salem. We're so glad you joined us for this episode, and throughout the half hour, some great guests and important information coming your way, including a discussion about election integrity, the integrity of elections, and what we're doing through the Board of Elections to ensure that, and many more topics and special guests, so stay with us. Where we want to start, though, is talking about money and the budget and the state budget, and how does that affect the county? And with us is a man who knows exactly about this topic. Dudley Watts, of course, County Manager of Forsyth County. We've had him on the program before. Welcome back.
Thank you, Jim.
We've gone, and I say we, in the state and the county have gone several years without a comprehensive state budget. Now this new budget, I'm going to call it a budget of sorts, has finally been passed. Now, in general, why is the state budget so important to the life of the county here in Forsyth?
So, Jim, Forsyth County is an arm of state government, and so we provide services to the state as sort of the underlying level of government across the state of North Carolina. And so, in the absence of a state budget, of a comprehensive state budget, there are things that don't get funded. There is confusion about what levels of service and all of that. And so it really is, most of what we do is mandated by the state. There's a lot of state money that flows through it, and it's really critical to have that state budget intact. And
we sort of have a series of mini, M-I-N-I, mini budgets that are in place. And so again, why is it so important that there be some kind of a consensus among these legislators and a compromise and the governor sign off on it? I mean, I know that there's partisanship. I know that there's arguing back and forth. But we're talking about vital services. Like later on in this program, we're going to be talking about the importance of mental health and behavioral health services. We're talking about paramedics. I mean, this is nothing to be political about. So why do we need to get this taken care of?
Yeah, so the states operated with what you said, mini budgets. They had not had a comprehensive budget signed by the governor over the last 3 or 4 years. This year, a couple weeks ago, we got the first one in 3 or 4 years because there was unspent funds in those prior years where there couldn't be agreement. So there was a lot of money in this budget, and so that was good. We fared pretty well, but it really is important to get a comprehensive budget. We got one the next 12 months, next 2 years, because it's a biennial budget. Will look very different than the last 2 years.
How involved were you or the county commissioners or somebody representing the interests of the county? How involved were we all in trying to shape what came out in the budget?
Yeah, so it was a decision made last year. The county commissioners voted to hire a lobbyist in Raleigh to represent the county. And so we've had representation there. We've had a presence there through a dynamic person who knows that well. Her name is Ashley Perkinson. She represents a number of other agencies that were not in kind of any way conflicting with the county. And so she's been down there. She's been our ears and our arms and legs. She's kept us abreast of what was going on. She's spent time talking to legislators about our needs, and that really paid off.
This is, I might mention that we are taping, this is episode 4 in our series of programs, and we happen to be taping this before the Christmas holidays. Mm-hmm. So I guess since this is the last time you and I will tape in this calendar year, let me just ask you, looking back on this year, and I know it's difficult, we've had the pandemic still to deal with and everything else, how have we fared budget-wise? What kind of shape are we in?
And I'll answer that, particularly in conjunction with the state budget and kind of where things are going. So this year, the conference report had over $300 million in Forsyth County specific projects, and those span the K-12 system, the community college system, the university system that's a big player in this community, the city, the county, the volunteer fire departments, all of those agencies. And like I say, there was $300 million to move projects forward. The airport got $23 million. The city got $10 million. City of Winston got $10 million for housing. A lot of the fire departments got new apparatus. Their old apparatus will be able to be rotated through that system.
Right.
It was amazing, and it will shape the future of this community for years to come.
Well, it's good news to start 2022 on, and then, which, in fact, speaking of that, I'll see you the next time on the other side. in the next calendar year, 2022. Dudley, thanks for all you do for the county.
Thank you. Happy holidays.
Same to you, sir. We'll be right back after this.
The life of every child is precious. If you care for a child or teenager with a disability and have limited income and resources, they may qualify for monthly cash payments through the Supplemental Security Income Program, or SSI. Call Social Security at 1-800-772-1213 or visit ssa.gov/SSI-Kids to learn more. That's ssa.gov/SSI-Kids. Message produced by Social Security at U.S. taxpayer expense.
Back now on Forsyth County Connections, and let's talk about emergency health problems and paramedics. And we have an expert in the field with us right now. Brent Motsinger is coordinator of mobile integrated health care for Forsyth County. Welcome to the show.
Thank you, Jim.
What is the primary focus of what you're calling the community paramedic program?
So our primary focus is 911 utilizers, someone that calls 911 a lot of times during the month. We get a list of those people, and we really reach out to them, outside of the normal 911 call, and offer extra resources to
somebody maybe has a chronic problem or something.
Exactly. Someone who has chronic health issues, didn't quite understand how to manage them. A lot of instances we end up interacting with people with behavioral health issues, substance use, and addiction issues. And what our goal is to get their reliance off of the 911 system and out of the emergency departments, and actually connect them with resources within the community that are built to actually meet their needs.
You're almost doing like a systemic triage thing, because you're trying to say, okay, here's how many calls we're getting from this person. Let's help them understand what's going on with their health and how we can help them minimize the emergency calls. I just think it's a fantastic thing. How new is this program?
So we actually started the program in 2016. It was a pilot, started with 3 paramedics. We currently have 9, and I'm the supervisor of those 9 paramedics. But like I said, it's morphed into a lot of different things since 2016. But our main focus is still, just helping someone who ends up relying on the 911 service quite often.
How is your program helping to fight the opioid epidemic?
So we work with many different organizations within the county as far as harm reduction and other things. But typically, when someone overdoses or is in active addiction and they don't know who else to call, the first number they end up calling is 911. So typically, they will interact with a paramedic on scene, and that paramedic, whoever's on the ambulance, knows about us, and they'll call us so we can actually go on scene while that person is either overdosed or requested help, and from that initial contact we can divert them to either inpatient or outpatient, supply them with Narcan, even direct them to harm reduction clinics to get safe using, equipment and stuff like that to stop, any spread of disease from sharing needles and other things.
Yeah, and once again, I think it's great that you and your team are working on in a comprehensive way to try to coordinate with the paramedics in the field, maybe on those emergency calls, and you're keeping up with that and talking to each other. I just think it's great. How's the community responded to what you're offering?
So we have had nothing but absolute just happiness and good feelings coming back from the community. It was surprising at first, because as EMS professionals, we never really get to have that engagement with a lot of community members.
That's
because
right.
We see them in the 911 setting. So it's just like, all right, you called us on the worst day of your life, and we take you to the hospital. But as community paramedics, we get to engage and really form a relationship, understand these people through a really good health assessment, and we form bonds, and we've integrated with lots of other community support networks, and we're really involved. And it's been a very positive response from the community.
And I guess the hospitals and healthcare providers themselves are pretty glad that you're doing this.
They are glad. Sometimes I feel like I annoy them a little bit, because that's a little bit of my job, is to look at the system as a whole and say, all right, these are areas that we could do better. These are areas that I see from a ground level that we're running into walls, or there's certain
Right.
roadblocks or gaps in the system. So let's do better and be better.
Now, you mentioned that you go through a sort of a database, and how many, if I've been having, 15 calls last year for the same chronic thing or whatever, I get that. But what if I am one of those people Is there a website or a phone number they should get in touch with to try to find out maybe if you can come and help them or what?
Sure. A lot of times, if you actually, when you call 911, they may actually from that comm center divert you over to us or give you our phone number. But otherwise, on the Forsyth County website under Emergency Services, we have a Community Paramedics section. So, and our contact information is there. We also have a list of resources, some crisis brochures, a lot of stuff that we actually talk about will be there for you to access on your own.
What a great compliment to the great emergency medical system we already have, and I just appreciate what you're doing for the community.
Thank you, Jim.
Thanks for doing this, Brent. We'll be right back after this.
When you take your car in for an oil change, a good mechanic will also take care of other routine maintenance to make sure your car runs safely and efficiently. Protecting your health isn't much different. When you get a COVID-19 vaccine, it's important to make sure you're also protected from other serious but preventable diseases. It's easy and convenient to get other routine vaccines at the same time as a COVID-19 vaccine. So make sure you ask a healthcare professional about other vaccines you may need to maintain your health.
Back now on the Forsyth County Connections, and we want to spend the next few minutes and actually the next couple of segments talking about health management in the county, about a new service that's coming on board. It's actually already on board, and we're going to start with a lady who knows all about this. She's Shontell Robinson, Deputy County Manager for Forsyth. Welcome to the program.
Thanks, Jim. Thanks for having me.
We've heard a lot in the news about this changeover, a new contract for mental health services. And I guess my first question would be, why was there a need for you to change it?
Sure. So, Jim, part of my role as Deputy County Manager, I also serve as the county's Health and Human Services Director. And I started in that position January 2020. And during that time, there have been lots of complaints just about the service delivery for mental health, substance abuse disorder, and intellectual developmental delay services that were being provided by the previous managed care organization, Cardinal Innovations. And so we really just wanted to make sure that our residents received the best service that they deserved.
Now, again, coming up in the segment after this, we'll talk with Jackie Copeland from Partners and sort of get the private sector perspective on how the transition is going. But from your perspective, and you're looking after all of our interests in your role, what can you tell us about the decision to go with Partners Health Management? Why go with them? Why was that a good choice?
So I will say, this process has taken over a year. We very much did our due diligence. There's 7 managed care organizations in the state, and we interviewed several of them. And Partners rose to the top as really sharing the values that we had. They really live to their name, Partners. They're very flexible. They really have listened to our concerns and have figured out ways to try to help improve service delivery here for our residents.
I'm going to ask Jackie the same question later on. Let me get your take. How would you assess the transition between the previous company contract and making your decision to go with Partners? How would you say the transition's going?
So the transition is going great so far. So we started technically effective November 1st, so it's only been a little less than 2 months, but so far so good. Quite frankly, it's been a breath of fresh air. The responsiveness has been tremendous. Their partnering and collaborating with us has really exceeded expectations. So certainly the verdict is still out since we're only 2 months in, but so far so good.
Now, I guess you can't talk about anything these days without factoring in the pandemic one way or the other. And so let me see how I want to phrase this. How much of a need do you think there is in the county for behavioral services, mental health services? And is there more of a need since COVID or less of a need? Do you have a feeling on that?
Yeah, I would definitely say that there is a tremendous need out in the community. We know that 1 in 4 individuals suffer from some sort of mental health diagnosis. I think all of us know someone that's been impacted by that. Some of us may be impacted by that, right? You just figure out ways to manage your life accordingly. And COVID has certainly exacerbated that. We want to ensure that our residents have access to the services that they need.
How do I know if I'm eligible? Maybe I'm dealing with a situation. Again, it could be some kind of addiction. It could be a behavioral problem. And yet, even though I know and maybe it's been diagnosed, how do I know if I'm eligible to receive services from the county?
Right. So, Partners manages the public system. So, for individuals who are on Medicaid that are uninsured or underinsured. And so, if people are not sure whether they are eligible through that avenue, I would certainly recommend that they reach out to Partners directly. They can go on their website, partnersbhm.org, or call their number, which is 1-888-235-HOPE.
Okay. Shontell, I appreciate everything you're doing to look after all the folks in the county and to get this contract going and up and running, and I appreciate keep up the good work.
Thanks, Jim.
All right. We'll be right back after this.
What do you think you're doing, Kevin?
Was just gonna drive home.
There are several warning signs present that you shouldn't be driving.
Like hearing voices?
Like your text-to-emoji ratio?
Oh man, the selfies. Selfie, nailed it.
We all have warning signs that let us know that we're probably not okay to drive. Mine is pretending to be your subconscious.
Craig, come on man, let's split a ride home.
As America's veterans face challenges, DAV is there. DAV helps veterans and their families get the benefits they've earned. Support more victories for veterans. Go to DAV.org.
Back now on Forsyth County Connections, and so glad to have this gentleman with us, not just because he and I went to the same university. We won't mention any names, UNCG. No, but we welcome Jackie Copeland to the program. He's Regional Director of Community Operations for Partners Health Management. Good to see you.
Jim, nice to be here.
Tell me about Partners Health Management and your mission.
Sure. Partners Health Management is a local managed care organization, and we focus on serving citizens and individuals who have mental health, intellectual disability, developmental disabilities, and substance abuse disorder issues. We work with them to try to work with them to find services that they need using our provider network.
What's your philosophy in trying to help folks? And there are a lot of us out there who have problems with one thing or another. It could be alcohol, it could be drugs, it could be emotional problems, whatever. What's your philosophy in trying to work with and help folks?
We have what we call we're known in the state for our Partners Community Commitment. And that is a practice where we are there for our members, their families, and we do everything possible in our power to make sure we get them to the services that they need. We do that in collaboration with community partners like county officials, other community organizations, and community stakeholders, because we really have a commitment to not only the members and their families, but also the entire community that support and try to meet the needs of these members.
Absolutely. Now, we are taping this particular program in December around the holidays, but now when you had a contract that started with the county, when did that start?
It started November 1st.
Okay. Now, how would you sort of rate the transition? How are things going? Because the county used to have another provider.
Yes.
They changed and went to you. And of course, we had some conversations with Shontell Robinson and others about that. But from your perspective as a businessman, how do you think the transition's going?
So far, we think the transition is going well. What we've been able to do is get in on the ground running, start to really working with not only members and their families, but other community partners, other county agencies to try to, one, learn about Forsyth County, and also to see how we can, one, maintain a smooth transition in services. As you mentioned, the transition from managed care organizations to partners, and we want that process to be as smooth as possible.
Yeah, every kind of transition, I didn't mean to interrupt you. Every transition, I don't care who you are or what you're doing, has challenges. Yeah. What kind of challenges do you face when you go into a transition like that in a new county?
Yes, great question. Yeah, in any transition, you do face some challenges and some hiccups along the way. And some of it is, as you can imagine, just transitioning from one organization to another organization. We face challenges. Our biggest thing we want to focus on is being flexible and nimble enough to be able to meet the needs of the members and their families. So with that, what we've done is try to really work with our local county government agencies, along with our provider network, members and families themselves, and other community stakeholders to try to address and mitigate some of those hiccups, if you will.
Now, I won't ask you to list the different counties and municipalities that you serve, but you serve a lot of county and clients. How are you finding Forsyth County to be? Maybe different from other counties.
Forsyth County is different in a sense. One, it's our largest county that we serve. We serve 13 other counties in North Carolina, and Forsyth is our largest one. And it's an urban county. So with that, you can imagine it has a ecosystem of different communities within that. And what our job is, we're trying to meet their needs, partner with them as much as possible, and also just learn them and they learn partners so that we can be able to provide the services that our members and families need.
Right. Now, how can people learn more about your company? Again, I'm not trying to do a commercial for partners, but it's important that folks in the county know, and people that you serve in other counties who are watching this program across the region. How can they learn more about what Partners is all about?
Sure. We have our website, partnersbhm.org. It has information on it about everything Partners does, our culture, our beliefs. Also has resources. It's a site that's, even since this a new services for Forsyth County members, it even has a welcome package out there. So members have received that in the mail, but if they want to see it online, they can go there and find that information.
Well, we're glad you're on board and also appreciative that you took a few minutes of your time to come by and visit with us, Jackie. I appreciate it.
Thank you for learning about Partners.
All right. We'll be right back after this.
This is what too much sounds like. This is what stress feels like. And this is what help feels like. If you've lost a job, worry about your next meal, or have trouble making it through the day, we can help. Text STRESS to 211-211 to find a solution.
This is the sound of confidence soaring.
Our mission is to educate, inspire, and honor.
This is the sound of honor roaring.
We should never forget those that gave their lives.
This is the sound of a generation rising above.
337 for Bravo Fox Papa.
We want to be involved in the education of young people so that they can take our aircraft and the stories that our pilots tell and realize their own dreams.
The Commemorative Air Force honors the heroes of yesterday while educating and inspiring the heroes of tomorrow.
Your future and how you live your life is dependent on how you think.
You can learn more at commemorativeairforce.org right now.
Back now for the final segment of this edition of Forsyth County Connections. And I'm so glad to welcome this gentleman, especially in this day and time when I don't care what political party you're in, it seems like there's a lot of vitriol and partisanship and debate and what election should stand and which shouldn't. Here's a man that knows all about this. Tim Tsujii is Director of Forsyth County Board of Elections. Good to see you, sir.
Good to see you. Thank you for having me, Jim.
List maintenance process. You sent me an email one day. It said list maintenance process. What is that?
Right. So we're actually gearing up for our biennial list maintenance process involving a mail out of confirmation cards that go out to voters that may have indicated to the U.S. Postal Service that they may have moved or changed their address.
Right.
And so we haven't received that change of information in our office. And so what we do is mail out confirmation cards to those affected voters so that they can then turn around and verify that information for us, and we'll then properly update their voter registration information.
There are always, dating back before my late father was involved in politics, there's always been debates about, oh, somebody's going to try to vote twice, or there's going to be fraud or whatever. And now, of course, this is still a debate point. There's still folks that believe that you can't trust an election system. So what are you doing in Forsyth County that maybe tries to ensure the integrity of our elections?
Right. So there's various safeguards in place here in North Carolina to ensure that security of our elections process, whether it be an audit process that takes place after the elections. We also go through a thorough and extensive testing process of our entire voting systems, not just here in Forsyth County, statewide. So we're not allowed to, by law, we're not permitted to use any voting machines until it's been properly tested. And so we go through an extensive process of that. There's other factors in play. You know, the voter registration system here in North Carolina. It's comprehensive and it's uniform statewide. So you mentioned, Jim, you brought up the list maintenance process that we already have here. Part of that process is where we go through a weekly and monthly check of any possible duplicate records, where if you have a voter that maybe previously registered in Forsyth County but recently moved to a different county in the state, we'll get that information so that we can properly update that information so as to prevent anyone from voting twice.
Yeah. Now, what is, you also mentioned in a note that you sent to me something about an Elections Academy program. What is that?
Right, yeah. So I'm happy to share with you, Jim, something that we did here in Forsyth County this past summer, where we held North Carolina's first Elections Academy program geared towards citizens to provide them with a behind-the-scenes look of what the elections process looks like. It's a comprehensive 6-week program where we invite citizens to come in and learn about the different processes and procedures and the guidelines and rules that are in place that governs and dictates how we administer elections here in North Carolina.
And so that anybody going through that is going to know absolutely that we have a real good system of elections in Forsyth County, and you're on top of these things, and there's no widespread fraud or anything to worry about. I'm not trying to make a political statement. It's just you guys do a really good job with that. And now, what qualifies somebody to want to take part in the academy, or how do they sign up, or what?
Right. So it was well received this past summer, and so much so that we're going to make this an annual thing for the county. It's open to any Forsyth County resident. We'll open up registration coming up this spring for the summer program. And it's a complimentary program. It's free to citizens here in the county.
I think that's great. Now, of course, we have the primaries that were supposed to be coming up, for congressional elections, U.S. Senate, whatever, in March. Now that's been moved to May until the courts can decide what to do, if anything, about redistricting. Has there been any gerrymandering done? Are we going to have, is the primary going to go through in March? Are we going to have a good election as scheduled in the fall? I mean, what's going to happen?
Yeah, I believe that we'll have elections in 2022. This is nothing new to North Carolina. We've had delayed primaries before. In fact, most recently in 2016, where we had a delayed primary for the U.S. Congress, for the House of Representatives.
Right. Maybe we'll get it all right one day. We have, as people can see on the screen behind us, or maybe my eyesight's not as good as a lot of folks watching TV, but it says connectwith.forsythcountync.gov is the general website we want to share with everybody. Can folks navigate through there, or is there a different site they should go to learn more about Board of Elections?
Sure. So our website is www.fcvotes.com. We also have a social media presence on Facebook and Twitter, so you can check us out, #FCVotes.
Folks, this is where you get the real scoop, right here from Tim, who works day in and day out, not just during elections. I want to get a plug in for that. You and your team work 24/7 just about, and it's throughout the year. Thanks for all you do.
Thank you, Jim.
And thanks, everyone, for watching this edition of Forsyth County Connections. We'll see you next time.